Yes. Yes, it's perfect. We can begin, ma'am.
Okay, okay, fine. So I welcome all of you and for everyone, I wish you all the World Ayurveda Day. And at the same time, I would like to wish you all happy Navratri. And it's the best occasion that Navratri is going on. And if we don't speak about female health, because Navratri represents the power of the female. So as we all have experienced the power of the female, but at the same time, it is very important to take care of uh, her health, because she is doing multitasking, but at the same time, she is going through different phases. And for that purpose, her health is very, very important. And in that case, a special thing that is her reproductive system. And that's why we have to take care of the reproductive system very nicely. And for that, Ayurveda helps. There are a lot of tips. There are a lot of things which will help us to understand that how we can nurture the female reproductive system. And today in today's session we are going to discuss about different kind of phases which a female undergoes. So what are those phases, and then how we should support her reproductive health. So in Ayurveda, woman is considered as Aadhar, that is support of the support system basically. And that's why it is very important, because of her reproductive system is not so strong, it will get transferred, right? How the society will remain healthy. So for that purpose, we are going to discuss this today's topic, nurturing female reproductive health. So Charak Samhita says about the in a Charak Sharirasthana, it talks about women are the root of a progeny, and without them, society cannot exist. So the root is very important, and we have to nurture that root. So Ayurveda sees life stages as the four parts, like Rutu Sutra, that is reproductive cycle, that is puberty, you can call. Then second part is a Yuvati, when she becomes a young adult. Then she gets married, and then Garbhini, that pregnant, the pregnant phase is over, and then she goes into the menopause, that is Vayo Vriddhi. So all these stages are very important, and in all these stages, it is important to keep the health of this reproductive organs very nicely. We have to take care of it, and that's why we are going to see phase by phase. So basically, reproductive health is a foundation of a life. That's why it needs to be strengthened. There is a growth happening, and then there is a progeny. So there's a giving new birth, new life, which is going to help the society, help the families, help all of us. So Ayurveda says that there are different types of dhatus. So first dhatu is rasa dhatu. So when we eat food, first dhatu, that is the first body fluid which is formed, is called as rasa dhatu. And from this dhatu, different transformation happens, and at the end, the shukra dhatu is formed. That is a generative tissue. From there only, the new life is going to form. So in female, it is considered as the ovum. And when shukra dhatu is proper, then Ayurveda says your ojas will be strong. So that means overall health of the female will be strong. So that's why Ayurveda says that like this Shukra Dhatu or Artava is very, very vital. And that's why it depends upon previous six dhatus, as we have seen Rasa, Rakta, Mamsa, Meda, Asti, Majja. So when all these dhatus are healthy, then only this dhatu is going to be healthy. And when this Shukra Dhatu or Artava Dhatu is healthy, then the Ojas, the supreme expression of the reproductive health, is going to be healthy. So that's why it is very important from initial stage, it should be taken care. So now we say like when stronger, like we have seen that how the Wi-Fi signals function. When it is excellent, that means stronger ojas. And when the OJS is not so good, that means there will be some problem related with some reproductive health or some other health issues. So Ayurveda, this reproductive health consists of four parts, four aspects basically, and we call them as a fertility factors. So these four parts are the key component of these fertility factors are Ritu, Kshetra, Ambu, and Bija. So Ritu means the menstrual blood, the monthly menstrual cycle plus ovum. Then Kshetra, that means the Garbhashaya, the uterus where this progeny is going to happen. Then Bija, that means seed, that is ovum, and Artava Srotas are called as a channels carrying reproductive tissue, that is Ambu. It comes under the Ambu, like circulation basically. So these are the main fertility factors, and these fertility factors should be proper to have a healthy progeny. So here dosha plays a major role. So like for example, Vata dosha, in the Vata dosha, there is a special type of a Vata dosha called as Apana Vayu. Okay. And that governs the downward flow. In the abdominal area, this Apana Vayu governs the downward flow. That is menstruation, ovulation, normal delivery, all those things will happen because of the normal Apana Vayu. Then there is a role of a Pitta dosha also. So Pitta dosha, there are again types like Ranjaka Pitta, Pachak Pitta, and Sadhaka Pitta. So they govern the transformation, hormones, ovulation, and emotional stability. So Pitta also should be normal. Then only all these things like hormones will be normal, ovulation will happen, emotional stability will be seen. And then there is a third dosha called as a kapha dosha. And in that, there are two subtypes called as a Shleshaka kapha dosha and Avalambaka dosha. So these are the two factors. If they are normal, then it will provide the stability to the female. It will give the nourishment of these reproductive organs. Lubrication and fertility also will happen because of the normal kapha dosha. So, and the dhatu we have seen like how rasa dhatu, it nourishes the reproductive system. Rakta dhatu forms the menstrual blood. Mamsa and Meda dhatu, they will be responsible for the normal endometrium and the supportive tissues. And Asti and Majja, these are the two dhatus which are responsible for the pelvic bones and neural regulation. And Shukra or Artava is a reproductive potential. That's why you see all these factors are very, very important. So right from what we eat, how we eat, that also matters a lot. So now let's see about the some parts about the menstrual cycle and how we should learn to manage through the Ayurveda. So normal cycle, Ayurveda says that it is 28 to 30 days, which we normally see. Like 4-5 days here and there also is okay. We consider it as a normal in a practical basis. Bleeding is generally 3 to 5 days. And the qualities of this flow will be, it should be normal, smooth flow. There should not be any pain or minimal pain should be there. And then there should not be any clots in the flow. So Ayurveda in Ashtangridaya, it says that menstruation is a natural excretion. It is not a disease. Actually, menstruation should happen. Then we consider that female's reproductive cycle is a normal. The reproductive system is normal. Okay. Then when there is an imbalance, when there is a vata imbalance, when vata aggravation is there, then generally menstrual cycle will be very painful. The bleeding will be scanty and the cycles will be delayed. When pitta imbalance will be there, then heavy bleeding will be there, irritability, burning sensation, and we can also see some acne also. That is because of a pitta imbalance. And when kapha imbalance is there, then cycles will be delayed. And that's what we see practically. Obesity, PCOS, white discharge, these are because of the imbalance of the kapha. So how to manage? Basically in Ayurveda, there are also, we call it as a menstrual regimen. In Ayurvedic terminology, we call it as a Rajaswala Paricharya. So these are the rules during the menstruation. So most of the time, many females, when I speak with them, like when a patients come to me, they are not aware about this menstrual regimen. So we have to explain them there is a regimen for menstruals during the menstrual cycle also. So what food you are eating, that is also important. Like it should be, the food should be very light, then you should take proper rest. There should not be any sexual intercourse during the Rajaspala Paricharya. No day sleep is allowed. No excessive talking or laughing, which gives you some kind of exertion. That is not recommended. Cold exposure is not recommended. So most of the female, they must be they must have observed that like with a cold exposure generally the period pain increases, and that's why we recommend them to take hot water bag so that the cramps will come down. So anything warm actually will help to support this menstrual regimen. Warm water, cumin or fennel or ajwain tea for the cramps, these are very common home remedies. Ginger jaggery tea if someone is kapha dominant female. So all those things for the normal flow, this ginger jaggery tea helps a lot. So these are the like simple rules which Ayurveda mentions during the menstruation. So we see many females, they are working, they don't take proper rest, they don't eat healthy, whatever is available they will eat. That affects their menstrual cycle, that affects their reproductive system also. That's why this is also very important. And most of the females are not able to follow these things, therefore they are suffering dysmenorrhea or menstrual problems or reproductive health overall we see has deteriorated. Why? Because they are not able to follow all these rules which are mentioned in the menstrual regimen. So common disorders which we see is they will have either dysmenorrhea. So for them we recommend like they can have some hingvashtak churnam or ajwain tea. Most of the females, they don't feel hungry also during the periods. This hingvashtak churnam or ajwain tea helps improving painful menstruation also, and also whatever associated symptoms she feels like abdomen will be bloated, you don't feel like eating, heaviness in the abdomen, all those things. So hingvashtak helps a lot. Even ajwain tea also helps a lot. Then irregular cycles. So that is also very common nowadays. So for that, shatavari is one of the best general tonic. Ashoka bark decoction is also recommended. Then heavy bleeding also is seen most of the in some of the females. So that we call it as a menorrhagia. So for that, Nagakeshar, Lodra, Musta, these are like some simple herbs which we recommend. If there is like too much menorrhagia, then it should be treated well by the doctor actually. And then PMS mood swings are again very common. So generally we recommend they should during that time period at least they should have more Brahmi tea, or they can sleep by having warm milk with some nutmeg. So that also helps improving the mood swings. If you just follow the female the menstrual regimen and take some of these simple remedies, that is also going to help to have a normal and healthy menstruation period, and it will be like more easy also. Warm milk with ghee is also recommended. Moong dal, rice, taking more pomegranate, drinking barley water. Some of the female, they will have some like sweet cravings also. So instead of eating unhealthy stuff, you can have mishri, or you can have jaggery. That also helps to improve the mood swings and these cravings. Then apatya, like these are the things which they should not take at all. Like sour curd is not recommended, spicy food, pickles, fried atom, anything directly from the fridge or cold items. And then heavy food and fermented food also is not recommended to have an easy menstrual cycle. Then certain herbs also are recommended, like Ashoka. We generally give like those female who have a heavy bleeding. For them, we recommend Ashoka Rishtam. Then Shatavari. Shatavari is the queen of the herbs for the female. So every female generally I tell to take the Shatavari. Aloe vera juice also helps to support the cycles. Hing, the asafoetida, one pinch of asafoetida also helps to reduce the cramps in the abdomen. And then some ready-made medicines are also available. Dashamula is one of the best medicine which has given me wonderful results for many of my patients. Then Ashoka Lodhrasavam, Navayas Gulika. Navayas Gulika is an iron supplement because you bleed a lot, you need some iron. So Navayas Gulika helps to improve the iron levels. As I explained, Ashoka for heavy bleeding, it balances pitta, regulates bleeding. Shatavari is a rasayana, it balances hormones. Lodra is recommended in excessive discharge because it has astringent quality. Then Kumari, that is aloe vera, already I have explained, it helps to purify the blood. It improves the blood flow. It is also very good uterine contractor. So it helps uh, painless uterine contraction. And then Dashamula, that also helps. Dashamula is a combination of 10 roots of different herbs. So that is the best Vata pacifying. That's why I have seen Dashamula Rishtam gives wonderful results in this menorrhea. And then certain yogasanas and pranayam you can do, like Supta Baddha Konasana, Balasana, and then gentle Anulom, Vilom. These are the things which will help to release the um, painful situation during the menstruation. Periods actually, I say like periods are like exams. If you have studied well, hmm, if you have studied well, then you will pass nicely. So if you have balanced lifestyle, then your menstruation will be normal and smooth. But if you don't, then it will give you cramps as like red marks. And then different cycle during this menstruation is just one part of the female reproductive cycle. So then there is a follicular phase, which is the phase where the egg starts maturing. So we recommend like simple food, like more grounding kind of food. Shatavari throughout the cycle can be taken. Ashwagandha is also good because it will help to healthy maturation of the egg. Guduchi is also recommended in this condition. Then there is a next phase is the ovulatory phase. This ovulatory phase is the phase where 90% is like fertile window, right? So 90% if there is a contact, then pregnancy will happen. So because this is a pitta rise phase, so heat and fertility peak will be there. So too much spicy food or too much heavy food we don't recommend because it will increase more inflammation. And herbs like lodra, amla, aloe vera, these can be taken. Then if pregnancy doesn't happen, then next phase comes, that is luteal phase. So where kapha dominance will happen, and then female starts feeling more heavy, more lethargic. So for that we recommend like warm food, nourishing food, and then herbs like they can have licorice tea, they can have a dashamula decoction or dashamula tea also. That will help to reduce this. Even this in this phase only you start feeling a lot of PMS symptoms, so they will also reduce with the use of the simple herbs. And then if a pregnancy happen, then it is like fertility and reproductive wellness. So as I mentioned, these four fertility factors like Ritu, Kshetra, Ambu, Bij. That means Ritu means the time, that is ovulation period. Kshetra means the uterus and reproductive tract. Ambu means the rasadhatu or the nourishment, and Bija means the quality of ovum and sperm. So if all these factors are balanced, then conception will happen. So these, if any of these is not functioning properly, then conception, either conception will not happen, or the progeny which is born may not be a healthy progeny. So that's why Garbhadhan Samskara is very much recommended in Ayurveda. I have given some few sessions also on this Garbhadhan Samskara, the importance of Garbhadhan Samskara. Nowadays, it is very important because most of the females are working, males are also working. They undergo a lot of stress, and then there is a, as we have seen that every dhatu should be nourished and proper. So if any dhatu is not proper, then definitely the child won't be healthy. That's why we recommend a lot of Garbhadan Samskara. And this is like a preconception. It includes preconception, panchakarma, like cleaning of the system. We recommend Virishnam treatment, Basti treatment. In some of the patients, we also recommend Vamana treatments. So these are the major panchakarma. If a couple does this panchakarma, then it helps to have a healthy seeds, basically healthy sperm and ovum, and so that the child also will be healthy. So we have seen like if a husband and a wife undergoes these panchakarma procedures, then definitely the child will not have a disorders which are running in the family, or if parents are having any health issues, then also they won't be the it won't be transferred to the child because the system is clean. So in this Garbhadan Samskara also we recommend these herbs like Shatavari, Ashwagandha, Kapikachu. Kapikachu is one of the best herb which helps, which is like a aphrodisiac. Basically, it helps to improve the sperm count in males. And Gokshura. Gokshura is also one of the well-known herb which we recommend to strengthen the reproductive tissues. Then we also recommend some kind of, after the panchakarma procedures are done, Then we recommend some of the rasayanas like palagritam, suvarna prashana to nourish the body of the mother and reproductive organs. Then milk with almonds and saffron also recommended. Then certain kind of yogasanas like bhujangasana, dhanurasana, surya namaskar. Then a good lifestyle like a dinacharya, early waking, abhyangam, yoga, avoiding stress and toxins. So if all these things come together, then we have seen the child will be, if it is a planned conception, then definitely there is a the child born will be like more healthy child. And we have seen difference also when it's a planned conception. We also guide to undergo panchakarma procedures, and afterwards also after conception also there are so many things to be followed. So if you do that, and many scientific things nowadays, you see that child absorbs the vibrations if you chant certain kind of mantras, if you wear certain kind of a clothes, if you wear certain kind of a jewelries, if you do some rituals, daily prayers, everything affects for the good health of good physical mental health of the child. So that's why these are all things are recommended. And then next comes when this reproductive phase is over, then comes menopause phase. So we get different kind of patients when they are in the menopause phase, and then they see that they also suffer a lot because there is a transition phase. Ayurveda call it as a rajo nivrutti, and the average age is 45 to 55. So it is a cessation of the menstruation. And this is like a vata dominant transition from pitta to vata. So, and then during menopause, many people will suffer when vata is imbalanced. Then they will suffer dryness, insomnia, joint pain, mood swings. When pitta is imbalanced, then they will suffer a lot of hot flashes. They can't sleep in the night. They get a lot of sweating, irritability. They get angry with small things. Then, if there is kapha imbalance, then they suffer from obesity, lethargy, swelling in the body, heaviness. They don't feel like working. They don't want to. Actually, this is a time period where they are retired from many of their responsibilities, but still they suffer terribly because of the imbalances of all these doshas. If they don't live a healthy lifestyle, then definitely their imbalances will be more intense, and then they suffer because of all these things. So certainly when vata imbalance is there, then we recommend to have more ghee, more sesame seeds, milk and soups to balance the vata. Then certain food items for pitta person like coriander, cucumber, amla, like a lot of green leafy vegetables, they also have bitter taste, which helps to pacify pitta. And then third dosha, that is kapha dosha. To balance the kapha dosha, we recommend barley, horse gram, honey, and ginger. So certain herbs also help in balancing. Shatavari is all lifetime, like from puberty till the menopause, it helps. Licorice tea also helps. It is cooling, and it because licorice is, it balances all the three dosha, so it helps in hot flashes also. Ashwagandha to support sleep and calm down the nervous system. Yashtimadu and licorice are same. They reduces hot flashes. Gugulu. So what happens like most of the time in this menopause phase, many females suffer from joint problems. So these are the gugulus. Also they suffer from weight gain. So gugulu help a lot to correct the metabolism, help to reduce the joint pain, joint inflammation, degeneration of the joints, and Brahmi tea also for the mood balance. So if you have Brahmi tea on a daily basis, that also helps to improve the moods. So management of the menopause. So there are certain specific combinations which will help for certain specific symptoms. Like if someone is suffering from hot flashes, they can have a combination of a shatavari plus licorice plus guduchi. They can also do some pranayama, shitli, sitkari pranayama. If there is a vaginal dryness, then sesame oil massages or ghee massages, abhyangam definitely helps. Hydration, healthy fats in the diet is also recommended. If someone is suffering from mood swings or irritability, then vata pitta imbalance is there. Then we recommend Brahmi. Jatamansi is one of the herb which helps in calming down, good sleep. It also helps to reduce the blood pressure. And then daily journaling, avoid caffeine, and all those things also help. If someone is suffering from insomnia, then for them we recommend they should have more like warm milk with nutmeg and with ashwagandha. And then if someone is and for insomnia, early bedtime, having a good healthy habits of sleep and light dinner. And for bone health, actually, vata imbalance or vata aggravation will be there. Then sesame seeds, ragi, triphala is recommended. Light strengthening, light strength yoga and sun exposure is also recommended. And then certain therapies will help a lot. Practically also I have seen patient becoming like calm, anxiety goes down with shirodhara. Then basti also helps to reduce the dryness, insomnia, digestive issues. Abhyangam helps prevent bone loss. And then some kind of yoga asanas like trikonasana, bhujangasana, meditation also helps. So I always say that menopause is like a promotion. Now you don't have much work, so less work, because physically also most of the females are retired, and then on the top there is no periods, but more responsibility. What is the responsibility? Not other responsibilities, but self care as a responsibility. And you get a free hot flushes in this phase of the life. And then like overall hormonal balance and how we can gain the overall well-being is like basically, as I said, like first dhatu is rasa dhatu. If you take care of that rasa dhatu only, na, then all the things will be taken care. So weak agni, Ayurveda says if digestive system is not so strong and the srotasas, the channels are not so proper, then both of them will create the ama and it blocks the channels. And when the channels are blocked, then you undergo endocrine imbalance, and that's why you suffer from irregular menstruation or infertility issues or like menopause issues also. Um, and then diet also, it should be fresh food. Most of the females I have seen that they will provide fresh food to all the family members, but for themselves they will not keep themselves as a priority. They will make everyone eat on time, but they will not eat on time. So it is very important to have a fresh food, seasonal food, more sattvic food, eating on time, avoid refined packet food, heavy and stale food. Most of female, when they are hungry, they will not cook for themselves. Whatever is available, they will just open the packet and have it. So that's not at all recommended in Ayurveda. And there should be a daily routine. The females who are staying alone, I find that they are, for them it is very difficult to follow a daily routine, because they will just make one meal, keep it in a fridge, again warm it up, again have it in the night time. Hare Krishna, Hare Krishna. I think I lost the connection. Am I audible? Okay. I think I lost the connection in between. Okay. So we were talking about the overall balance, because as I was talking that everything is important. Every phase of the life is important. And but in that Ayurveda says the root cause of all the health issues is the digestive system and then channels. So channels should be open and digestive system should be strong. So for that purpose, we recommend that you should we should have a more of a healthy lifestyle. And mind also is very important, along with just the daily routine and seasonal regimen. um, a healthy mind also plays a very important role. like positive thoughts, mantra chanting, meditation, all those things also should be taken care. And then whenever possible, I have seen many females throughout their life, they never do any massages, they never do any panchakarma. So certain panchakarma as are really, really recommended. Nasyam or Rasayana, rejuvenation, at least after 30, 40 years, you should give your health priority. So basically, hormones are like doshas. Like if one misbehaves, like the whole family starts shouting. That's why we have to take care of it. So give priority to your health. Certain herbs I would like to explain, like bala is very good for strengthening the tissues. Manjishta is very good for if there is a pitta dominance. Manjishta tea is available. Manjishta sticks are available in the market. Triphala, many of you are aware, many of you must be taking also Triphala for the constipation issue, for the hot flushes. It's like a rejuvenating herb, so can be taken on daily basis when you are in any phase of life. If you are suffering from constipation also, then also helps. So Triphala is always helpful for the system. Guduchi is for the improving the immunity. It also helps to reduce the stress. Guduchi is very good for the joint health. So, and certain panchakarma, basically, when there is a vata disorder, infertility, cramps, and all, then we recommend basti. Uttar basti in most of the time in infertility or a cyst and all those conditions, we recommend uttar basti. Abhyangam to improve the circulation, Chirodhara for relaxing, and Svedana again to improve the circulation and relieve the kapha stagnation. So age-wise dosha dominance in Ayurveda care. Basically, when puberty phase is there, that time it is like it is more kapha dominance is there, and that's why we recommend they should eat more uh, light diet and avoid junk, because in this period I have seen that many girls, they don't care only, they eat a lot of junk and then they end up into having a PCOS or infertility, and then they go to the doctor. It is better to avoid all those things, try to have more healthy lifestyle, establish some routine and exercises. Then reproductive age, like pitta dominant age, that is a pitta dominant phase basically. So fertility care is very important. Anything excess like too much heat and stress and all those things, should try to avoid all those things. And at least before conceiving, at least once you should undergo Vireshanam treatment. You yourself also will experience good health, and the child who is will be born also will be healthy child. And then menopause, that is a vata dominant phase, so it should be like more nourishing, warming lifestyle should be there. Calming diet and therapies like vastis are recommended. And post menopause, you have to focus more on your bones, heart, basically mind and heart. So SPS is one of the treatment which helps to nourish the bones. And then general herbs for the female reproductive system. Already I have talked about them a lot. Shatavari, Ashoka, Lodra, then some churnam like Hingvashtak churnam, Trikatu churnam. So these should be part of your daily regimen basically. Shatavari to all female except those who have breast cancer or all those conditions. Then we don't recommend. They should use such Shatavari with the under the guidance of the doctor. But otherwise, all the females I recommend Shatavari. Ashoka, generally we recommend for heavy bleedings, menorrhagia, and all those conditions, because it is a pitta pacifying and it is cooling herb. Then Lodra, Lodra is one of the herb generally that also we recommend in menorrhagia. It is also bitter and astringent in taste, and it's pitta and kapha pacifier. So it helps to strengthen the uterus and also helps to prevent the inflammations. Then Hingvashtak Churna. Generally, this is very common churnam available. It also we recommend for the digestive health. So it helps to reduce the cramps and bloating and flatulence during the period. And then Trikatu churnam is a combination of three herbs: ginger, black pepper, and long pepper. So it is pungent in taste and it helps to improve the digestion, relieves the bloating, and promotes circulation. So Trikatu churna is also available. Sorry. And that also can be taken in your herbal tea. You can add, or you can also have just 1 teaspoon before the meals in that way, or with you can make a tea out of it. That is also possible. Sorry. And then specific herbs for the menopause, again, Shatavari is common, licorice, Brahmi, Jatamansi, and Guduchi. These are the 4 herbs generally I recommend for the menopausal phase, because their symptoms are like that. They feel hot flashes and restlessness and lack of sleep and low immunity, heat in the body, irritation, weak joints, weak bones. So for all these symptoms, these herbs are very safe herbs, can be included on a daily basis. Practical tips for the and like for the healthy overall good reproductive system is track menstrual cycles. Whenever possible, self massage with the warm oils. Whenever possible, you can do self detox also, like with the trifala, warm water, having light diet. Then mindfulness, meditation, journaling for the emotional balance, and seasonal adjustment also is very important. So whenever like when the climate is hot, include cooling things. When climate is warm, and then include when climate is warm, then include cooling things. When climate is cold, then include warming foods. That is also very important. So you have to understand that you are not ruled by your hormones. You are actually CEO of them. Ayurveda is just your HR manager. It will help you to keep them disciplined. So uh, this is like one shloka. It says that like where women are honored, the divinity blossoms there, and when they are dishonored, all actions remains unfruitful. But my suggestion to all of you, actually, don't wait for anyone honoring yourself. You honor yourself. Take care of your health. Your reproductive health is the main core of your good health. So if you take care of the reproductive health, overall health will be automatically, you will achieve the overall health. So thank you for the patient listening. If you have anyone has any questions, I think we have some time for 15 minutes for the question answer. So if anyone has any questions, uh, I'm here to answer your questions. And thank you all very much. So actually there is a one question in the chat box. uh, what to do if I missed a period cycle? So first thing is you have to monitor your cycles very nicely. If it happened only once, if you are married, then generally, if you are married, generally there will be, you have to check whether it's a pregnancy. Second thing is like if it has happened first time for you, then you have to find out there could be some reasons. Sometimes if there is a stressful situation, then many females they miss their periods. I have seen during the exams, because of the exam fear, they miss their periods. So if there is no pregnancy and if there was a stress, then you can wait for another cycle, and you can start taking something like shatavari or something like that, which supports your normal menstrual cycle, and then wait for another cycle. And if it happens again, then you have to go to gynecologist. You may have to do ultrasound. So most of the time we observe 1 2 cycles, but if it is happening again and again, then check whether if there is a PCOS or if there is a any hormonal imbalance. And so if you just miss there is no pregnancy, you checked you checked on a urine pregnancy kit and it is showing that there is no pregnancy, then certain things certain things like simple ginger tea, ginger jaggery tea with little pinch of asafoetida helps to initiate the periods. So taking something which is hot in potency, that also help to initiate the periods. But make sure no pregnancy should be there. Okay. And then there is a another not question. It is an inquiry. Can we get the recording? I think the it is recorded. Session is recorded, so you will get the recording. Uh, there is a I'm not married and it happened for the first time. Okay, so you have to observe next cycle. If you're not married, then definitely you can have a ginger jaggery tea twice a day. You can also have some asafoetida before your meals, 1 pinch of asafoetida before your meals. You can also take some food which is hot in potency, like for example jaggery or dates or papaya, all those things you can have at least for 7 days. If you take them, then definitely you will get your periods. And then there is, if it still doesn't happen, then there is, we can give some medicinal support also. There are some tablets like Raja Pravartinivati, Kumari Asavam. They also help to initiate the period. So for that, you have to go to your Ayurveda doctor and consult. But you can try simple home remedies like that. There is a question that I have a continuous mild headache and breast pain during periods. Find some? Can I find something about it? I'm 45. Okay, so mild headache and breast period. So actually 45 to 40, 50, this is like, or maybe 55, this is like menopause period. So most of time it is transition phase from a pitta to vata. But if periods are regular and if breast pain is there, then you can include Shatavari to your daily regimen. So you can take 2 Shatavari tablets with some, if you are taking milk, you can take it with milk at bedtime. That will help to ease the periods, and even it will also help to reduce the breast pain. Mild headache could be because of the excess pitta in your body. So Shatavari is a cooling herb. So definitely it will help in headaches also. Yes, Shatavari can be taken. Shatavari is recommended for a normal hormonal balance. So Shatavari will definitely help. There is a question that I'm 30 years old and does frequent white discharge indicate any problem? What is the cause and can you suggest remedies? Okay, so see, basically, white discharge, there are different kinds of white discharges. So, if white discharge is in between ovulation period, then it is normal because it is to facilitate the sperm entry into the uterine area if in case conception happens. So that is absolutely fine. If a white discharge has any foul smell, then there is an infection. If there is a itching sensation in the vaginal area, then there is an infection. If white discharge is like profuse discharge, like the menstrual like a menstrual blood, that kind of a discharge is there, then also there are chances that there is some hormonal imbalance. You can try taking Shatavari. Then Lodra also helps in all these conditions. Washing the area with the Trifala water also helps. And if, as I said, if there is a smell and all, then there is definitely there is an infection. So you need to treat it. But if it is just during the ovulation period, or just some female also experience some kind of white discharge before the menstruation. That is also absolutely normal if provided that there is no smell and there is no itching sensation. Uh, there is a question. My teenage daughter doesn't like to do exercise, take Ayurvedic herbs. She suffers from heavy menstrual periods. Kindly suggest what should be done. See, if there is a heavy menstrual period, then she has to follow that menstrual regimen. You have to explain the importance of it. When she experiences the period, the pain is reducing by having a proper menstrual regimen, then automatically she will start following. But you have to initiate it in. You may have to force little bit initially. We also recommend Dashamularishtam during the painful periods because Dashamularishtam very good remedy. Now it can be taken 15 ml 3 to 4 times a day before the meals. Like 15 ml of medicine plus 15 ml of water. You mix. You take the medicine and then you take the meals. So that also helps to reduce the painful periods. And healthy lifestyle is very important for teenage. It is very commonly seen that they eat junk food, they don't do any kind of exercises, and they land up having PCOS or hormone imbalance. Maybe you can show some pictures to your daughter how PCOS looks like, how you get beards, mustaches, how you put on weight, how it is difficult to conceive, how it is uncomfortable feeling basically having all these hormonal imbalances. So maybe out of fear, she may follow a certain kind of a regimen. What is the proper method of taking Shatavari only in the milk? So it is not compulsory to take Shatavari with the milk. If you take it with the milk, then it is okay. That is the good thing. Ayurveda recommends it with the milk. But if someone is having a intolerance, lactose intolerance, then you can take it with the hot water also. That is also fine, no problem. You can take Shatavari as a powder form. You can take Shatavari tablets also. 2 tablets at bedtime with hot water, hot milk is recommended. Then there is a question how to take Triphala every day in morning or night. with what to be taken. So Triphala is a detox herb. It can be taken at bedtime because it's a mild laxative also. So it will help to clear your stomach also in the morning time. So Triphala churnam, if it is available in the powder form, 1 to 2 teaspoon with hot water can be taken. If not, if it is available in tablet form, then 2 tablets with hot water can be taken. Best medicine after menopause. Uh, Again, depends upon the symptoms. If you are underweight, then ashwagandha can be taken on daily basis with hot milk or maybe hot water. And along with that, you can also take certain if you have sleep issues or something like that, then you can along with that, along with ashwagandha, you can combine with something jatamansi or brahmi. But ashwagandha, I'll say, is the best. But only the thing is that if someone is putting on weight, then ashwagandha may increase the weight more. So for them, what are their health issues, what they are suffering, accordingly we recommend. How can we know which doshas we have? So basically for dosha, you have to undergo that dosha analysis test. But as I have explained during the session, that imbalances, how to understand what are the imbalances of dosha. If you are suffering from joint problems, insomnia, dryness, vaginal irritation, these are vata imbalances. If you are suffering from heaviness and all, then these are kapha imbalance. If you are suffering from mood swings, irritation, hot flushes, then it is pitta imbalances. But what is your normal dosha, that your Ayurveda doctor will be able to tell? Hare Krishna, what can be done for the para ovarian cyst? So, what is the size of the cyst? When it happened? What is age? So, all those things matter a lot. Sometimes, if it is not giving you any imbalances, if you're not experiencing any imbalances, then you can neglect it. If size is big, then you may have to undergo surgery. So it depends upon the size and what symptoms you are having. What is the effect of taking asafoetida? It increases vata, pitta, or heat, kindly guide. Okay, asafoetida is a hot in potency. It is very pungent herb, basically. Pungent asafoetida is a chemical, basically, Ayurvedic. But it actually increases pitta if taken in excess, but it reduces vata and kapha dosha. So asafoetida means, like in Hindi we call it as a hing, right? So it is a uterine contractor, and it helps to reduce the cramps. And if someone is suffering from flatulence, bloating during the PMS period, then also asafoetida helps to improve the appetite and reduces the flatulence. So asafoetida dose is very small dose, just a small 1 pinch. And if someone is having pitta dominance, like hot body, then asafoetida, but still having pains, then we recommend asafoetida with some ghee. So you mix, you take one, uh, maybe 1/4 or less than that of ghee, and you mix this asafoetida, 1 pinch of asafoetida, mix it with the ghee and lick it, and then have your meals. For vata also this can be done. For kapha, there is no need of mixing ghee. You can just have 1 pinch with little bit of warm water, have it, and then have your meals. So it helps to reduce the cramps, helps in bloating, improves the digestion. If clots during, next question is, if clots during the periods, it is something serious. So basically, Ayurveda says that your menstrual blood should be clot free. That is considered as a normal. But we have seen that in some kapha dominant females, there might be clots. But for those conditions, we recommend Ashoka Rishtam, because uh, if you are not having any health issue, despite of having clots, you conceive normally, you have a good menopause, all those things, then there is nothing to do with your, sometimes it's your body's tendency also. But if you are suffering from any of these health issues regarding the reproductive system, then you have to take medications to reduce the clots. There is a next question, that I am phase of 45. Kindly suggest a good Ayurveda to avoid such problems. I face now like a pitta, mood swings, irritation. Okay, it looks like you are a more pitta dominant person. So it is generally, this is the, from 45 onwards, the transition phase will start from pitta to vata. And most of the pitta dominant females, they suffer from hot flashes, mood swings, and all those things. So Shatavari is one of the best option for you. Licorice, that is yashti madhu. You can have a tea, a licorice tea. That also will help to reduce the mood swings and irritation. Try to take more raisins, more mint leaves, more cumin, CCF like cumin, coriander, and fennel tea. You can include. So all those things also will help. You can also have Brahmi tea in between. So that will also help in improving your moods basically. So Brahmi is available in a tablet form. It is available in for powder form also. You can take Brahmi tablets also. You will feel the difference. Thank you, Jyotiji. There is a question. I think questions are over, it looks like. Okay. There is a question. Is endometriosis irreversible? Uh, Again, depends upon condition, since how long a patient is suffering from endometriosis. The issue with the endometriosis is that most of the females, they are unable to conceive because of the endometriosis. So they have to undergo a lot of panchakarma procedures. They also suffer from period pain. They get severe dysmenorrhea. So again, reversible, maybe if it is just initial phase, just recently diagnosed, then definitely with the panchakarma we can reverse it. But if it is consistent since long duration, then it's difficult to reverse it. That's why we have to watch your cycles. If they are too much painful, immediately undergo ultrasound, check whether there is endometriosis developed. Accordingly, we can treat the patient. There is a inquiry that 3 centimeter para ovarian cyst in a left side, 35 years of age. Okay, sometimes pain or swelling there. What can be done? So see, basically, para ovarian cyst has it won't be affecting much on the cycles or the hormones. So you can stay with it. You can just observe whether size is increasing fast. 3 centimeter is a moderate size. You can also take some Ayurveda medications to reduce the size of the cyst. If you take the medicines for 3 to 6 months, definitely size will reduce. And yeah, some kind of a panchakarma procedures also will help, like vasti treatment. We generally do lekhana vasti. That will also help to reduce the size. So it's after seeing the patient only, most of the things can be guided. But yes, definitely, we can make some change the size of the cyst. Then there is a question. I feel pain in breast before periods every month from 2 years. After periods, it subsides, so it is normal. Okay, so this comes under period PMS actually. Yeah, most of the female, because of some hormonal imbalances, they may feel breast engorgement, pain in the breast, which is absolutely normal. But you can ease it with the by taking the Shatavari. Thank you. Okay, thank you, Prem Kunji Mataji, for your thanks, Purva Radha Mataji. Thank you so much. I think questions are over. So if you have any further queries and all, then you can check. There is a number on the screen. This number on the screen of reception. You can communicate through the reception. Definitely, Ayurveda is of a great help. Suruchi Kapoor. Okay. I'll just try whether I can unmute you.
Uh, yeah, Mataji. Hare Krishna, Mataji.
Hare Krishna.
Yeah. So, Mataji, I have one question. So, you've been mentioning about Shatavari. So, I just want to know that, my mom, in the past, she had colon cancer. And of late, she means now she is being cured and she's doing good. but she have a lot of weakness and bone issues. So and she is almost now 69. So can we give Shatavari to her, first thing? And secondly, is there any particular brand which in Shatavari we need to take?
Yes. See, basically for your mother, now Shatavar, because she is 69, so reproductive, that phase is over, reproduction. So for her, more than Shatavari, Ashwagandha is better option.
Okay.
Okay. So give her, because now it is a phase of taking care of her bones, joints. So ashwagandha is better option. So 2 tablets of ashwagandha with milk or with hot water can be given at bedtime.
Okay.
And brand, I will say, as a Priya Chaitanya Prabhu also initially he announced that we are in collaboration with Vaidyaratnam, which is one of the topmost brand of India. So Vaidyaratnam, I have seen that the best medicines are available. Even Ashwagandha, Shatavari, all are available of Vaidyaratnam brand. So I'll recommend that brand. That's the best.
Okay. Vaidyaratnam.
Yes, Vaidyaratnam.
Okay. And ma'am, Mataji, the Shatavari a person can take till the menopause is there. Once the menopause is over, one can stop taking Shatavari, right?
Yes, yes,
Okay.
because Shatavari helps in reproduction basically, hormonal correction and reproduction. So
Okay.
generally, when menopause, during menopause period, we recommend, depends upon if someone's body is too hot, then we still recommend Shatavari, but more recommendation is for Ashwagandha than Shatavari.
Acha. Okay. Okay. No, I am asking because now I'm almost 43 and
Mm.
I'm slightly feeling some changes in my body. So I was just thinking, should I take Shatavari or how is it?
So Shatavari will ease the menopause. So
Okay.
till menopause happens, you can continue with Shatavari, and
Acha.
then later on, you can shift on taking Ashwagandha.
Okay. Okay. Okay.
Yeah.
Thank you, Mataji. Mataji, can you just mention in the chat the name of the brand which you
Yeah.
have tie up with? Yeah.
Yes. Yes.
Yeah. Okay. Thank you, Mataji. Hare Krishna.
Hare Krishna. So Vaidyaratnam is the name of the brand. So and it is available on Amazon also if you want to order. It is available at our center also, Ayurveda, Govardhan Ayurveda. Okay, so thank you everyone for your patient listening, your enthusiastic questions. Thank you. Happy Navratri and happy World Ayurveda Day.